Thanks, Maurice. And look, we appreciate the opportunity to be invited here today to give an overview, albeit a whistle-stop one, of the European Health Data Space, or EHDS regulation, and the Health Information Bill 2024. And of course, it's always great to be back in UCD. So, the EHDS is going to be implemented by way of EU regulation. So to give you a flavour as to where we are just on the cusp of finalising the legal translation. So this means that while it was originally intended that it would be published by the end of this year, publication is now going to be put back probably until Q1 2025, hopefully as early as possible, January. But there is just, but we'll wait to see on that. It will become effective 20 days after publication. You might be aware that EU regulations are actually directly effective in member states. There is no need, strictly speaking, to bring in legislation to implement it. However, Ireland usually favours a belts and braces approach in this regard, so it is planned to transpose it into legislation through a suite of legislative measures over the next few years, both by primary and secondary legislation. And as it's implemented, it will follow a phased timeline, which will span 2027 to 2031. So in other words, 4 years after publication. So, for example, in 2027, Q1 2027, that will be the deadline for the appointment of what is known as the supervisory authorities. So each member state is required to appoint 3 supervisory authorities to support EHDS implementation. And these are the Digital Health Authority, which will facilitate exchange of health information for primary use. The body known as the Health Data Access Body, or HDAB, which will facilitate exchange of health data for secondary use, and also then the Market Surveillance Authority, which will be responsible for monitoring compliance of EHR systems with the regulation. And each of these supervisory authorities will come with enforcement mechanisms. And then by Q1 2029, we're really hitting the business end of implementation of the EHDS regulation, and the data space will be established. So who benefits by the EHDS regulation? The short answer is everyone, but we look in particular at healthcare practitioners, bearing in mind the audience today, and also, of course, patients, because fundamentally this is about patient rights and patient empowerment. But to give you a flavour in relation to healthcare practitioners, so by 2029 they will have access to the My Health at IE portal. So that is the platform which facilitates access to electronic health records and can view and add relevant information to the patient's EHR. In relation to training and supports, a healthcare practitioner will know how to access training and supports to understand data quality and standards, how the EHR system works, and what their legal obligations are under the regulation. In terms of visibility, they will be able to see the priority categories under the EHR, the patient summary, e-prescriptions and e-dispensations, unless that access has been restricted by the patient. And I'll talk a little bit more about that when looking at patient rights. And then in relation to awareness, practitioners will know how to contact the Digital Health Authority and how to use the My Health at EU platform, which is the platform for exchange of health information across member states for treating Irish and EU residents, and they will be aware of their rights and obligations. And then looking at patients, for a patient by 2029, they should be able to see again the priority categories of a patient summary, e-prescription and e-dispensations in their EHR, and they can download a copy of their EHR. And they can also grant access to their EHR to an authorised representative if they so wish. They'll be able to see the contents of the EHR, where information is recorded in electronic format, and this is across sectors, be it public or private, and as long as it's in scope. They'll be able to edit and restrict access to their EHR, and they will, but also importantly, that they understand the impact of this restriction, and that should be explained to them at this point. They'll also understand that in certain circumstances there will be an override to this restriction if it is in the vital interests of that patient to do so. In relation to consent, they can provide their consent to the reuse of their data for secondary purposes. And again, they will have the option of an opt-out in relation to that, and they understand both the impacts of that and the potential override. And they'll also know who the HDAB is. The EHR will be portable, so they can request access to their EHR when receiving treatment in any EU member state, and that their healthcare practitioner can also add data to their EHR during their treatment. And finally, in relation to visibility, they can see who has accessed their EHR and control notifications about who has access. And they can also see that the EHR system is EU certified. So as I mentioned at the start, there will be a suite of legislative measures over the coming years to facilitate the implementation of the EHDS regulation. And the first of these is the Health Information Bill. So the drafters might disagree, but we consider it a lean and focused bill. And it was published in July of this year, and it cleared second stage in the Doyle in September of this year. And there was a very positive reception at that time for it. And as was said in the introduction, it aims to provide a clear legal framework to enable initiatives in digital care, including, of course, the electronic health record, which is referred to in the bill as the digital health record. And it also introduces new obligations on health service providers, be it public, private or voluntary, to share health information for the delivery of care and treatment and for specified purposes. And these obligations are set out in each of the bill's parts. And there we have it, Part 1, Part 2, which is the duty to share, Part 3, which is the backbone and introduces digital health or electronic health records, and Part 4, which touches on the use of information for secondary use. So in relation to Part 2, so this is the bill's duty to share provisions, and this is a really important step in providing a more holistic view of patients and their care and treatment. So under the duty to share, a health services provider who is providing care and treatment to a patient must share that personal health data with another health services provider who is also providing care and treatment to the patient concerned. Practitioners will also be under an obligation to forward personal health data to another provider at the patient's request. And in circumstances where there may be a cessation of health service, providers must take certain steps to safeguard the personal health data when intending to cease providing those services, including informing the patient of the steps it proposes to take to ensure that their personal health data will be transferred to another health services provider. Part 3 is, as I said, the backbone of the bill in many respects, and it provides for the introduction of digital health records for all patients. And this is obviously a critical step, as has been touched on by other speakers. Under the bill, the HSE is tasked with creating and assigning to every patient a digital health record. And this record may be used by a health services provider for the purposes of the care and treatment of a patient, as well as by the HSE for specified purposes consistent with their statutory remit. It sets out the categories of information to be contained in a digital health record, and the main headings are there. And these categories correspond to the contents of the EHR under the EHDS regulation. In relation to the patient summary, there's 18 information categories contained there, and that again corresponds to the information contained in the EHR. For the purposes of the digital health record, the HSE can request health service providers, including private and voluntary providers, to provide personal health data as it considers appropriate and specifies in a written request. And there is a number of compliance measures around that, including, if necessary, the possibility of an application to the Circuit Court to compel provision. And then in relation to Part 4, which concerns secondary use. Now, I should say, by and large, the Health Information Bill doesn't overly focus on secondary use, but we have tried, when bringing through this bill, to EHDS proof it as much as possible. So there you'll see that the bill will aim to enhance the provision of information to the HSE for secondary use purposes under its remit. And it can request this information from what's known as a relevant person, which includes a public hospital or a body established by or under an enactment to perform functions in relation to health services, Section 38 or 39 bodies within the meaning of the Health Act, or another person other than a person referred to in paragraph B, with whom the executive has entered into an arrangement to provide health services, and this would include a lot of private providers. And then it also sets out what those specified purposes are, and these align with the first three categories under the EHDS regulation. It includes a public interest purpose in the area of public and occupational health, the development of policy and regulatory activities, including service planning, and for statistical purposes. So finally, just to let you know, as I said, it cleared second stage in the Doyle at the end of September. We were very excited about moving that red arrow down, but the election has intervened somewhat, so we're paused there for the moment. But in light of the fact that this is very much a welcomed bill, we are hoping that we will be able to pick up where we left off once there is a new government, a new committee in place, and that we will be in committee stage in the Dáil early next year. So thank you very much.